Hey, so it's me, Raul, here. Actually, I'm at Stanford University. I'm here at a virtual reality and healthcare seminar. I want to there's a lot of things that we spoke about today. Um, Actually, it was a big, long list of different presenters. I kind of want to talk about um, at least one that I think was a crowd favorite. It was Dr. Giuseppe Riva from Italy. So he's done a lot of work with virtual reality, and he's kind of presenting a lot of his work with patients. One of the interesting things that one of the interesting ideas that he brought about was the idea that our brains aren't necessarily reacting to our external environment, which they do, but the thing is, our external environment, the way we understand it and the way we understand ourselves, is actually a projection of our brain. So um, that um, that's called predictive coding, or that's the terminology he was using. So this is something you can look up online. You can basically our brains are giving us its projections of what it believes our reality should be, and we kind of live in that projection. So our brains are actually um, a virtual reality headset. That's kind of the way we kind of the way the doctor kind of explained where. Our brains are actually that virtual reality headset. So if we were to put an actual other virtual reality headset on, we can actually change behavior for the better. So we can actually improve health outcomes. His case, he works with a lot of morbidly obese patients, and I believe he's also worked with some Parkinson's disease patients and other types of diseases. But it seems like overall he works more with obesity. There are other presenters who work with other types of um, degenerative diseases and dementia. And basically, you can use virtual reality to affect change in the patient. So whether it be uh, allowing the patient they say like for pain, like if you can put a patient into virtual reality, and then if they have an arm that it has chronic pain, and if they can actually see an arm moving, it doesn't have to be even as realistic. That's what the research is showing. It can be very a simple animation of an arm, and if they can see it moving without pain, then that actually disrupts the projections that our brain has been giving to us, and so it changes the way we understand that painful limb as well. So um, that's one of the really interesting things. And also, virtual reality improves motivation and compliance with treatment, with medical treatment, especially when they've used some avatars of the patient. So that means that they're using or they're creating semi-realistic avatars, and so it actually look pretty much like the person, maybe just slightly animated. Um, so that's one of the things that came out. And also another tidbit of information was that um, immersive VR is actually what creates this behavioral change or the improved health outcome, but games in virtual reality don't. So like these video games where people are, like if they were to create a video game that maybe would attempt to try to change behavior, that's not quite. It doesn't really work. So another doctor, Patrick Bordnick from Tulane University, they actually created um, uh, like VR scenarios for patients, addiction patients. So, say whether it be alcoholism or even heroin. So they've created environments where a patient can be immersed in this environment, so it'll be realistic. Like say uh, they gave us the example of heroin addicts where they would actually go to a home that represents maybe an environment that they would be in, where people who look kind of familiar to them, or at least kind of like the same region, they start shooting up, and so then they teach the patients like ways to recognize a bad situation, and they try to teach them mechanisms or coping mechanisms and ways to get out of these bad situations. So whether it be heroin or alcohol or other types of addictive substances or addictive behaviors. So those are kind of some of the main things that um, yeah, some of the main points here that I thought were quite interesting. I mean, there actually was a lot more, um, but I think it would make a really long video. I got a lot of notes here, but I think those are some of the main things. All right, so thanks for watching. And actually, this was day 1, so there's a whole full day. So I'll probably make 2 videos about tomorrow's information. All right, thanks for watching.